we're seeing a 34% increase in explant surgeries, which is just taking out the breast implants, and a decrease, 14.9% decrease in breast augmentations, again, during that time frame in 2018 to 2019. And I will say, based on some of the numbers that I have here, that there are 400,000 women a year get implants, and only over 100,000 are for reconstruction after surgery, like a mastectomy or breast cancer.
Yeah, exactly. In the past 3 to 4 years, we have seen a tremendous increase in the number of people who are concerned about their implants, whether or not they're having symptoms or they have just heard of someone else having symptoms. But we see people often who, just want to know, are these okay? Should I have done this? I've had my implants for so many years. They've never given me a problem, or maybe they have given me a problem. What should I do about it? So it's something that I talk to patients about frequently.
And so the literature would indicate, right? So, first of all, how long have implants been used for?
They've been used since like the 1960s and 1970s. Now, the implants have changed since that time because there was concern, there was, silicone leakage and things like that that happened much more frequently in the first generation of implants. But we are now on our fifth and sixth generation of implants. So things have changed dramatically. But, yeah, they're there, they are safe. Many people have them. So
And that's unusual for a surgery to have been used for so long. If there's a tremendous amount of complications, is that true from a surgical perspective?
absolutely, because things that, in the surgical field, things that we implant into patients, they go through clearance. They go through rigorous studies and protocols to make sure that they are safe and they are, something that can be placed inside the body and to be there for, whatever the expected duration is. So an implant, a breast implant specifically, now the paperwork that you sign whenever you get it, it does state that it's not a lifelong device. However, it is safe to have breast implants for as long as you live, and this is obviously a case by case basis, whether or not you actually want to have them your entire life or not.
And how often should someone, if they do have breast implants, how often should they change them?
So there's no set number, we've always heard, and, as patients, because I personally myself do have breast implants, we've always thought, oh, they need to be replaced every 10 years. That is the manufacturer's warranty on the device themselves. However, if you have an implant, you're seeing a doctor, especially if you have any concerns or you have any trauma to the area, and you're following up, and if you don't have any problem with the implant, it's perfectly safe to keep it for much, much longer. Recently I've taken care of patients who their implants have been in for 25 years. And we take them out, maybe because they need a lift and they want to downsize or upsize, whatever reason for the revision surgery, and the implants are perfectly intact. So
Hmm.
there are cases where you can keep it much longer than the quote unquote manufacturer warranty.
So, what are some of the biggest risks that people are concerned about with breast implants in general prior to, say, this breast implant illness, which I really would love your take on in terms of what is it? How do we
hmm
diagnose it?
hmm
Where do the
Yeah,
problems lie? Yeah.
right. So before BII became really, I don't want to say popularized, but before it became something that more people were aware of, things that we worried about with breast implants were rupture. Okay, is the implant going to pop? If you've got saline, it's quite obvious when it pops because your breast quickly deflates. Or, if you've got silicone or the type of gel and things that have been used in the past, would it leak out? Would I feel some pain? Which could lead to something called capsular contracture, where your body forms a harder scar tissue capsule around the implant itself. Movement out of the position of the pocket. Immediately after the surgery, we would worry about things like hematoma, so bleeding and bruising around the implant. And then in a certain generation of implants before, there is a certain type of lymphoma that's been associated with implants. So those were all the potential risks, all extremely, low percentage of happening. But now we have an additional, diagnosis that doesn't have a necessarily clear definition, as we would hope, nor a clear set of diagnostic criteria as we would hope, and that's the breast implant illness. So, especially with, and all the studies state this, so I'm not speaking just off the cuff here, but with the rise in social media, there has been an incredible amount of awareness of a potential disease or a disease that is called breast implant illness. And this is where patients who have implants, and it's been studied and reported in patients with both silicone and saline, are reporting systemic symptoms. So symptoms that sound very much like an autoimmune disorder, as in they're having myalgias, muscle pains, arthralgias, joint pains, fatigue, brain fog, just overall feeling of unwellness that people have started to associate or attribute to their breast implants. So that's where we're at. We know that it is a thing, and we don't exactly know who's going to get it or what type of patient is going to have it, or if it's more common in one person versus the other.
So, does the totality of evidence um, show that this could be an issue, so much so that it would be something that people have to really consider, or is this more very fringe from a medical perspective? And I know that you teach, don't you? You do teaching.
Yeah.
You teach
So
other physicians. Yeah.
yeah, exactly. I have been a voluntary associate professor for the University of Miami, for Kansas City Medical School University, Nova, different universities throughout my area. And I've had students, medical students, residents rotate with me. I participate in, contributing to the literature, reading the literature, trying to stay up to date in everything related to my field. In preparation for this talk, of course, I, took a deep dive, and I was like, let me find out the nitty gritty. Like, what do we really know and what do we not know? And unfortunately, what we do not know definitely surpasses what we know about this condition. So you've got a patient who has breast implants and has a lot of systemic manifestations, which, not to downplay these because they're real,
Right. Of
they
course.
are suffering from all of these problems. But can we find a direct or even indirect link from the actual implants itself to the systemic symptoms? And right now, there's no direct cause. It's kind of like the chicken before the egg. Like, do you
Hmm.
have someone who's predisposed to autoimmune diseases or has a enhanced immune system that is reacting to an implanted device, or did the implanted device trigger an autoimmune response? Or are they totally not related? There's no real answer yet, unfortunately.